Hello beautiful nurses. Hi guys, how are you all doing? Good morning, good afternoon, and good evening. Good day wherever you are watching from. So guys, today we'll be talking about the mistake to avoid when doing your implementation in NMC UK examination. All right, the mistake that you need to avoid so that you can pass your exam on one sitting. Yes, on your first attempt, you can pass your exam. Please, especially on your implementation station, there is minor mistake that we are doing that we don't know that is going to be a fail. All right. The first one is allergy check. Very important. Do you know that when you are doing check, know that your patient is allergic to penicillin, you can have co-amoxiclav when you are doing your implementation station under regular medication, and it is due at your time. You are going to administer that medication because you did not ask your patient if he's allergic to this medication, and then it's normally written on your book. Yes, here you can see here. Let me come closer. See, penicillin is there. It's going to be written boldly and the side effects of this medication on your implementation book. And then your patient is also putting on red wristband. Yes, the patient is putting on red wristband with the name of the medication is allergic to and the reaction and the name of the patient's hospital number. This is very important. All right. So when you move in to write your examination, first thing you need to do is to identify the patients. Know that if you have the same patients. Hello, I'm Nurse Gold. I'm here to administer your prescribed medication. All right. Is it a convenient time? She will tell you yes. Okay, please. You now ask him, please, can you tell me your full name and date of birth? Let me reconfirm that with your wristband and the paperwork you have with you. Okay. Now, you hold it and read it against the wristband and the paperwork. All right. Okay. Your name is, please, can you tell me your name? John Field. Okay. I have here John Field. John Field. And date of birth, 10/2/1950. Okay. 10/2/1950. 10/2/1950. And hospital number is 00124. 00124. All right. I can see that I have the right patients. You now ask, please, John, you mind if I call you John? Yes, please. Okay, John, are you allergic to medication, latex, food or dressing, anything at all that you want me to know? Yes. The patient will tell you, yes, nurse, I'm allergic to penicillin. Oh, bless you, John. Is that the reason why you are putting on a red wristband? I can see that. Okay. You now check your book. Allergy to penicillin. Allergy to penicillin. So sorry. All right. And then, John, are you, what side effect do you normally have when you take this penicillin? She will tell you rashes. Okay, rashes. All right, rashes is the same thing with paperwork I have with me, and I can see also in your red wristband. All right, I'm so sorry, John. I'm not going to be administering any medication that you are allergic to. All right, she will tell you. Thank you, nurse. You proceed. You see, this thing can never be deleted from your memory when you see penicillin derivative when you are administering that under regular medication. Okay, so moving over to the next one now is ID check. You have done the identification when you come to meet your patients. Now, when you are reading this prescription chart when you are reading it out so that assessor can hear you and your patient is hearing you, you are also checking to make sure you have the right documents. Yes, you have the right documents. You open it. Okay, I can see I have here with me hospital medication prescription and administration record for John Field. Date of birth is 10/2/1950. Hospital number is 00120. Okay, now let me flip over to know. I still having the same patient's detail. John Field. John Field. I can see I'm having the same patient. John Field. All right, John Field. And the last one is John Field. Date of birth is 10/2/1950. Okay, and hospital number is 00124. Assessor, I can see that I have the right patient. You have identified the second one. Then when you move over after bringing out that medication to go and meet your patients, John, please, can you still tell me your full name and date of birth? Let me quickly confirm that again with your wristband and paperwork with me. I'm so sorry about that. John will say, no problem. My name is John Field. You can see this is the third one we are identifying that patient. Okay? My name is John Field. Date of birth 10/2/1950. Okay, John Field. Date of birth John Field. Date of birth 10/2/1950. Date of birth 10/2/1950. And your hospital number, you read it again. That's the third one. And also your allergy. You are identifying it three times. When you first come in to meet the patient, when you are reading your prescription chart, and when you go back to give the patient medication, when you identify the patient, ask the patient detail and confirm, you're also asking the patient again for any allergy to reconfirm it again that you are not making mistake with the wristband together. Guys, please, if you did not do this thing very well, it's a red flag, it's a fail. That is it. Okay? And then after you must have read your prescription charts, bring out the medication, and then moving over to the patient, make sure you tell this patient the indication and side effects of that medication. If you do not explain the patient the indication and side effects of the medication and give the patient medication, it's a fail. You have to tell the patient the reason why you are giving this medication, what it does, and the side effect. The patient will tell you, okay, thank you, no problem. John, this paracetamol is for pain. It's going to help to reduce your pain. As you tell me that you are having pain score of 3 out of 10. And this, you might get side effect like nausea and vomiting. John, are you happy to take this medication? Yes, please. Finish. Okay? Now, another trick you can see is here where you see weight. Make sure you are identifying patient's weight whenever you are giving paracetamol. Guys, please listen. When you are giving paracetamol, make sure the patient's weight is not below 50. And then coming to the dosage of the medication, the patient is having 1 gram, which is 2 tablets if it's 500 milligram each. You're going to administer 2 tablets, right? Okay, and then this patient's weight is below 50 kg. Please don't give that medication because it's incomplete, it's incorrect. This patient is having below 50 kg, and doctor prescribed 2 tablets, that is 500 milligram for 1 gram. You are meant to administer 1 tablet, guys, 1 tablet. So go to the assessor. Please, I noticed that my patient's body weight is below 50, and the under regular medication paracetamol was prescribed 1 gram TDS or 4 times daily maximum. I'm not going to be administering this medication. I have to escalate this to my doctor to be able to get accurate prescription or correct prescription from my patients. Then when you go to your patient, John, I'm so sorry, I'm going to talk with the doctor concerning your pain relief medication. All right? That is it. Tell him the reason that those that were prescribed for him is 2 tablets or 1 gram, but according to his weight, is this supposed to get up to that extent? John will say, oh, okay, thank you, nurse. That shows you know what you are doing. The assessor will just smile because it's a trap that you did not fall inside. So guys, yes, that is it. It's a trap. Do not administer it all, please. Except you see that your patient's body weight is 49 or 48. And then coming to the paracetamol charts under regular medication, you are seeing 500 milligram. Give. Yes. It's 1 tablet. Give it. It's expected of him or her to take that dosage. Right? Okay. So, in all sense, what I am saying is when you have 2 tablets or 1 gram of paracetamol for a patient that is above 50. From 50 up, give medication is expected, is 2 tablets. But if it's below, you can't take 1 gram. All right? Okay. And then the next one I also have here is maintaining 5 rights of medication. 5 rights of medication. How do you maintain 5 rights of medication? Is, first of all, you have identified the patient. Okay? And then you read your medication. You read it. The name of the prescriber, the NMC number or GMC number of the prescriber is here. The signature of the prescriber is here. The BIP number of the prescriber is here. You can now tell the assessor, I am happy to administer this medication as is valid, complete and legible. And then you are making sure you have already identified this patient, which is the right patient. You are with the right dose of medication and the right drugs, that is right medication. You are giving it at the right time and they are the right routes. Yes. Okay? That is it. Okay? Now, the next one I have here is do not sign. Please, guys, do not sign here. Here, you see this place that is meant for anybody that have administered this medication. Your name, your number, the signature. Here, do not sign. Do not sign if you have not administered this medication. You come in to do your examination and this book was given to you. You are reading it. When you are reading it and you now saw that you are meant to sign here, don't sign it. Oh, please do not sign yet until you finish your administration, guys. Until patient has taken that medication and you are sure the patient has swallowed the medication, then you can tell the patient, please, can you give me a minute? Let me sign my documents. You can now sign that the medication has been properly administered with your name, date, signature. That is it. And time. Yes, they normally give time. Okay. Then moving over to where you are meant to sign, like this medication here, the time is today. You are giving 12:00 hour medication. You are supposed to sign under today. Today, you put the date. Today can be any day, guys. Today can be any day though. That you see today, some people are making that mistake. Today can be tomorrow. I might come to work. You work today. I can't work the next day. And then I saw you read today. I will not administer this medication though. Because there is no date. You can see date is today. That's what they wrote here. And here you are coming to write today again. I will not administer it because I didn't know if you gave this medication today, I've been tomorrow, I've been next tomorrow. That is where you have to put your date 10/2/2020 or 10/2/1950 or 10/2/2025, depending on the day you administer this medication. Put your exam date, please. When you put your exam date, then you sign. After this patient must have been taking this medication, not when you are dispensing it from the container. If you sign this thing as you are dispensing it on container, is a fail. Yes, one of my friends failed because of this. And she had to go back to go and administer the medication, allow the patient to swallow, take it properly, and then she cannot sign. Because of the signing, that's why she failed. You can see it's a red flag, right? Okay. Then the next one is coding. Coding well. Yes. When your patient is allergic to medication, 10 is a code 10. Just go to where you omit that medication. Where did I keep it? Here. Oh, not here, this one. Here, omitted dose. Under omitted dose, You write date is today, name of the drug is paracetamol, dose is 1 gram, route is oral, instruction for pain, time of giving, not giving, you didn't give it, not giving, reason, you write your reason. If the patient is allergic to paracetamol, you write code. They have already written code / delay or increase greater than 2 hours. You just put patient is allergic to paracetamol. Simple. If he's omitted dose for other reason, you have already written this code here where you are writing today. You code it. And then you come back here and then you put code 2 again. You put code 2. Other reasons, because it's been written here. It's here, see it. You just pick your code 2. Here is it again. Here. Patient is off ward. That's why you do not give the medication. Just write code 2 there. Okay? And then under code 5, start dose given. If you are giving medication and you notice that the start dose has been given, and then during the regular medication, the patient still have this medication, and it's not up to 4 hours interval or 3 hours interval for you to give another one, just go to omitted medication and code it. Code 5. Put 5 here. Code 5. Write all these things here, and then reason for not giving. Code 5. You sign. That's all. Okay, so guys, that is it. I think this video is getting longer. All right, I'm going to do another video concerning this coding. Just watch out for it. I'm going to explain it very, very well, because so many of us are confused on how to code our medication. All right, so guys, if you get value for this video, make sure you watch it to the ending over and over again to avoid this mistake. Okay, remember to identify your patients 3 times. Allergy check 3 times. All right. The medication is valid, legible, complete. I am happy to administer. Maintain the 5 rights of medication. Do not sign if you have not administered. And code correctly. Manage your time very well. When you are doing your practice in the house, you can set 11 minutes or 12 minutes. You can use it to do administration of this medication, so that you are going to get used to it. During your examination day, you are going to have extra 3 minutes written. I did my own the day I went to write my exam. I did it for 12 minutes because I'm used to practicing for that 12 minutes. I still have extra 3 minutes. I just have to be using the time to be checking if there is any mistake. When I finished, assessor said, good, you still have extra 3 minutes. You can use it however you want to. I quickly open up all the signing I did, check all my medication. That is it. And make sure that once only medication is very important. So me, during the day of my own was just under all the medication, all this grammar, all the things that I've written. It was under once only medication. The 3 of them was there waiting for me. As I administer it under once only medication, I went to regular medication. I was still seeing the same medication under regular medication. I did not administer it again, because I've already dispensed this on under once only medication. You don't have to administer it again. Are you giving overdose? Yes. That is it. And also check if it's due on your time. The ones that are due on your time, and give. All right. Thank you so much for watching this video so far. Go Chooks, love you all. Thank you. Still remember, guys, if you get value, subscribe, comment, like, and share to lovely nurses out there that is preparing for the NMC OSCE examination. This exam is actually simple and it's doable. All right, you can do it. You can do it. Just practice, practice, practice. Read your marking criteria. You can achieve this at first sitting. But if you mistakenly do not achieve it on first sitting, do your best. You can achieve it in second one. I wish you all the best in the world. All the best of luck. Okay. Bye. Congratulations, guys.